Talk about Sajid Javid, the new health secretary, a breath of fresh air after Matt Hancock, and I think this statement sums up why he's the right man for this job.
We can't live in a world where the only thing that we're thinking about is COVID and not about all the other health problems, not about our economic problems, our educational challenges, and we have to make use of a vaccine that is thankfully working and be aware of all the other health problems. As health secretary, I tell you, when I came into this department with a fresh set of eyes, it is shocking when you look at all the other health problems that have built up. Some 7 million people have not come forward during the pandemic for help from the NHS with their health problems. 7 million people.
Well, he sounds actually shocked there, doesn't he? Let's talk to the former head of analysis at the Office for National Statistics, Jamie Jenkins. Good evening, Jamie.
Evening, Kev. You good?
I'm good, and I think Sajid Javid seems like he's good as well. He is the breath of fresh air that this crisis needed. Would you agree?
Well, I think so, Kev. If you look at his CV, he's probably in a good place to come into the role because he was the former Chancellor. Obviously, I think he had that big spat with Dominic Cummings with regards to SPADs and who's in charge of the SPAD. So it's a bit like Cummings has gone and Hancock. I know Cummings was trying to get rid of Hancock. He's obviously gone, and Sajid Javid's probably come in as the right man because he's run the business department as well, and we've been hearing all the stories, all these businesses decimated by the pandemic. He's run the Treasury, so he's not just probably coming into this, Kev, looking at the lens of just health. He's going to be looking in terms of paying for it because it wasn't that long ago. It seems like a while back when George Osborne and David Cameron were in charge, Kev, but I remember back in when they were in charge, they put 2 billion quid into the NHS in a year. And it was major news. It was all over the newspapers, all over the media. They put 2 billion in. And just in the last month alone, we spent another 2 billion pound on the furlough scheme. You've still got 2 million people still on furlough. So lots of people say, no, we don't need to ease any more restrictions. Everything's back to normal. Well, the 2 million people out there who are still on furlough and the cost of all of this is money that could be spent on fixing this backlog in the NHS.
Yeah, I mean, as I just said, that Sajid Javid sounded himself very shocked that 7 million patients haven't come forward. At least 1 million more, possibly more, have tried to come forward. We've heard stories of enormous backlogs of patients who did try to come forward and can't get treatment, have been deprived treatment because of the COVID crisis. Some would say because of the NHS's fixation on only treating COVID at one point. And Sajid Javid is saying, I'm not the COVID secretary, I'm the health secretary. It's good that we've got a health secretary that sees the scope and the scale of the general problem as opposed to just obsessing on curing us of COVID.
Well, yeah, Kev, he's got a massive job on his hand. Now, we've got huge numbers on waiting lists, as he's talked about today. But remember, we had huge numbers on waiting lists before the pandemic. The pandemic just made things worse. And what you've probably got as well is the GPs are being closed. People are being too scared to go and go to hospitals. Many people have gone to hospital and died having COVID within hospital. So we might not even have the true figure yet, Kev, because there's so many people who haven't come forward to the NHS over the last year. That's a ticking time bomb. You're probably going to see now over the next few years that the kind of a rise in probably cancer deaths, a rise in heart disease because of all of these undiagnosed problems. It's great that he's coming in to kind of sort it all out because there has been this fixation on COVID. I led the team at the Office for National Statistics looking at all the death statistics from a range of different causes. And in the most recent data out again today, Kev, it's been like this for several months now, that we've got 10 times more deaths from flu and pneumonia, probably mainly more pneumonia than we have from COVID in the latest week. But yet, on the news, you turn the news on tonight on the telly, and it'll be how many people have died from COVID. There's people dying of all sorts of things. COVID is a relatively low risk of death at the moment. We're seeing cases go up. We know that. I think what the Prime Minister yesterday and Sajid Javid have been quite honest with the people, saying all of this. They're not trying to scaremonger. And I think having a health secretary now coming in, being quite open with the public, I think one thing we need now, Kev, is this confidence for the public, because we've seen mental health problems the last year doubling. And with the health secretary putting some confidence, go back out there, live your lives, that hopefully will help reduce the number of mental health issues, because it's all going to be backing up, Kev.
Yeah, without wishing to be a bit of a harbinger of doom, Jamie, as a former ONS man, you would predict that over the next few months, maybe the next year, that some rather nasty statistics might come out about the COVID crisis?
I think so. We're going to see kind of the backlog of all the things that haven't been fixed over the last year will kick out. We're going to see deaths go up from COVID over the next few weeks. I wrote a blog a couple of weeks ago, Kev, saying that we're going to have to live with a level of risk. If we'd been testing for flu the last 40 years, every winter, we would have seen rises in cases in younger people. We wouldn't have been pushing to say vaccinate everybody with regards to all of that. We would have locked down probably every winter in the last 40 years we were testing for it. So what we've got to do now is learn to live with the virus. We are going to get these deaths, as Chris Whitty and Patrick Vallance were talking about it. And it's just going to be tragic when we see the kind of the post-mortem with an inquiry as to regards to all of the fallout of all this. And I think we're probably not going to fix the backlog of the waiting list in the next 5 to 10 years. We've got a huge backlog, Kev, and we couldn't tackle it before the pandemic. So it's going to take a huge investment to do that. Whether or not he'll be backed with the Chancellor to do that is another thing.
Yeah, I think, as I say, in the year to come, we're going to find out the true realities of what we've been through, the real effects. And I don't want to be depressing, but I don't think it's going to be good news. Jamie, great to talk. Thank you so much for your time. Jamie Jenkins, former head of health analysis at the Office for National Statistics. I'm Kevin.